Hello, this is Margie Meady, and I'm recording the PowerPoint Therapeutic Groups for the Nursing Psychiatric Mental Health course. And it's important to understand that therapeutic groups occur in a lot of different professional situations, and that as a healthcare professional, you're going to be sharing your personal life with a lot of different groups of people in a lot of different group situations. And it's a really good mechanism to enable clients to learn from each other. And what we're going to talk about in this PowerPoint are the dynamics and functions of therapeutic groups and the nurse's role in these types of interventions. So this slide just points out some perspectives of what a group is. It's a collection of individuals who are connected by some sort of a purpose. Either they share a common interest or a value or a norm or a goal. They are together usually for a reason. There's some sort of common ground that they share that's kind of structured them into a group. And membership in a group is usually by chance. A lot of times people are simply just born into a group, a family group, a relative group, a community group, a group based on where they go to school. Sometimes it is a choice to belong to a group, and then that would be a voluntary affiliation. So maybe you join a group because you know that you want to develop your artistic abilities or your writing skills, or maybe you join a support group to help you deal with a certain situation. Sometimes groups are formed just by circumstance, something that people don't have a particular control over. It just might be, for example, you just become to a point in your life where you just naturally evolve into a group of people that are experiencing the same sorts of things that you are. So, for example, you might become known as a member of the elders in your community, or you might be actually known as a resource group, a group of knowledge bearers in your community. So again, just some perspectives on what actually a group is. So this slide goes over what are the actual functions that a group serves, what are the purposes of a group. It could just simply be for socialization, where you get together because you want to share activities together, and it's a very comfortable group to be in, or it could be that it's actually teaching people how to socialize and learn about the social norms of others in the group. So for example, it could be really informal, where you join a group of like-minded individuals and you really want to belong to that group, and you don't really follow the norms of the group, but because you like that group and you want to stay in that group, you start to follow their norms. So an example that I could give for an informal group like that would be, you join a group to develop your artistic skills, and everybody seems to bring an example of whatever project they're working on to the group, and you never bring a project because that's not something that you were thinking was part of the norms of the group, and now you realize that if you want to be included in the group and be taken seriously for being a participating member, you're going to need to start sharing some of your artistic work too. Or it could be that it's a structured group to help people socialize, and that would be what we would encounter in the mental health psychiatric setting. We would put people in groups to learn from each other. So I mentioned this in one other PowerPoint where the mental health group and the mental health providers here in Kodiak, we have a community support program that has a tea party and every week for people in that program, and that's where they learn social norms. So they learn how to talk, appropriate socially appropriate topics for conversation when you're in a setting like that, and then they take what they've learned to other parts. They go home into their family, and then they can participate in the socialization that's going on in other areas of their life as well. Could be simply a support group that people form a fellowship because they have a need to have somebody help them, or a group of individuals help them through something that is a crisis in their life or where they need to have some support. It could be that you join a group because there's a certain task that you want to complete, a certain endeavor. It could be a community group that wants to accomplish getting a playground put into a certain neighborhood. Or it could be a work group that's trying to accomplish certain things to happen in their facility or their place of employment. It could just be that you socially enjoy somebody's fellowship and camaraderie. So that's a function of a group, that you just enjoy being with a certain group of people. Could be informational, where you go to a group to learn new knowledge or new skills. And so learning would take place in that type of a group. It could be a normative group where the different groups are, again, established to enforce norms, some various norms. And it could be an empowerment group where groups get together to voice each other's ability to make an effective change. Sometimes groups can bring about a change when individuals alone are not as effective as when they band together and work, as a cohesive group. And it could be a group that's formed to govern a certain aspect of community life. And usually when there are large organizations that have a governance type of a role, there is a leadership that is provided within that group rather than a single individual, like a group of leaders, a leadership structure that is part of those types of groups rather than a single individual that runs a group. So just a little bit more details about types of groups. A group can be a task-oriented group that's, again, formed to accomplish a specific outcome. Could be a teaching group to convey knowledge and information to a number of individuals. Oftentimes, these groups are just a one-time event, but they could be ongoing. So, for example, you could provide a community outreach type of a group where you, every time they meet, have a different topic that they provide some information to the community. Or you could have, let's say, childbearing classes, childbirth classes, where that's a series of classes that's intended to support people that are getting ready to have a baby. So it could be a series, it could be a single event, it could be an ongoing thing. Supportive or therapeutic groups are usually an ongoing type of a situation where they don't just have a one-time meeting and then they end. They usually have an ongoing membership, and they continue to meet on a regular basis. And they usually help participants deal with emotional stress that can come from situation or developmental crises. So what are the differences between a therapeutic group versus group therapy? So group therapy is based on a sound theoretical principle, and the leaders of those groups have advanced degrees in psychology, social work, nursing, or medicine. So group therapy would be provided by somebody with that advanced knowledge. So it wouldn't be a nurse that's teaching nutrition or smoking cessation or even teaching about over-the-counter medications. This is a group therapy designed as a treatment intervention. So that's the difference there. This is considered a treatment that somebody has to have advanced knowledge, kind of like where you have to have an ability to prescribe or determine what would be the best intervention. You have that advanced knowledge to allow you to make the decision on what group therapy would be an appropriate intervention for somebody. Whereas a therapeutic group is based to a lesser extent on that theory. I mean, they do have a theoretical basis, but they're focusing more on the actual interactions within the group members and how they relate to each other, and using the group as a way to provide those things that we talked about earlier. But whether you're a leader of so group therapy, you'd have to have advanced knowledge. You'd be an advanced practice nurse in our situation, or a social work with an advanced degree. Or whether if you're working in a therapeutic group setting, both leaders of those types of group have to be aware of what group process is. In other words, You have to be able to evaluate how the group is interacting with each other and whether it's appropriate or not. And you have to be very knowledgeable about the group content, the topic that's being discussed in the group or the issue that they're dealing with. So it wouldn't be a good idea for someone that has no knowledge about grief support to lead a group of people that are trying to deal with a loss in their life. It wouldn't be a good idea for somebody to lead a group if they didn't understand group processes and how members interact with each other and what the purposes of that group interaction would be. Self-help groups are usually composed of people that kind of form together to help each other with a similar problem, and they help to reduce the possibility that the person is not successful at adapting to that emotional distress. So this is a really good way that people can independently manage their stress and adapt to it better. So this may or may not be a professional leader. A lot of times members themselves will run it and rotate the membership among themselves. But it does serve a really important purpose in that it can help people adapt to a stress that they're trying to deal with in their life and help them achieve adaptive coping strategies rather than have it become a chronic ongoing stress that then leads to stress-related disorders or a psychiatric mental health problem because of their inability to resolve their problem or adapt to the stress that they're experiencing. So this slide goes over some of the physical conditions that can influence the way the group functions or the dynamics of the group, and it just is some points to keep in mind when you're trying to make sure that the way you're planning the group or how you're getting it organized will facilitate the best functioning of the group. So the seating is listed here, that you don't want to have barriers between the members where a circle of chairs is better than chairs around a table because the table is then a barrier that's kind of comes between the members of the group rather than giving that open feeling. The size of the group makes a big difference in how well people are able to interact with each other. 7 or 8 members is a very favorable group size. The bigger the group, the harder it is for people to have individual participation, and the more constrained they're going to be to participate because they feel a little bit more self-conscious. Doesn't seem as intimate, doesn't seem as inviting for them to participate or socialize with a larger group. And then membership. You can have 2 different types of membership. An open-ended group where members can come in and out, back and forth anytime that the group is going on. So let's say we have a group about people that are dealing with myasthenia gravis in their community. And they meet every month, and sometimes a member will come and sometimes they're not going to come because they're having problems with their condition at the time, and they're not going to be held, the group norm is not going to say to them when they get back, oh, you didn't participate for the last 2 meetings, so we're not going to, discuss things as much with you. We're going to kind of shun you a little bit. That would never happen in an open-ended group. It's expected that people come and go as they need to participate. And there'd be no expectations for people to be there consistently or not. Whereas closed-ended groups, the members all join at the same time, there's an organization to it, and then the group terminates at a certain designated period of time. So for example, a task group that was, I mentioned trying to get a playground in their neighborhood. So they do all of the things that they feel they need to do to accomplish that goal. The playground is put in place, they've achieved their purpose, and then they no longer need to meet. So those are some considerations that this slide presents. So this slide and the next slide talk about the curative factors of groups, which is something that I think you really need to, kind of get a good knowledge base about. What are the ways that groups can have an influence on the mental health of the individuals in the group. So understanding these concepts, these curative factors, is really important for you to get a good handle on. So installation of hope, by observing the fact that other people in the group have a similar problem to the problem that the participant is experiencing, it gives them hope that their particular problem can be resolved because they see it has been resolved for other members in the group. Universality is where individuals realize they're not alone in trying to deal with a certain problem. They may feel really isolated, and becoming a member of a group helps them realize they aren't alone. There's a lot of people that are trying to deal with that same problem, those same feelings, and it helps establish the fact, again, that they're not alone. Imparting of information, this is when members are sharing information with each other and knowledge, and it can be a two-way street, so sharing of information and knowledge. Altruism, where individuals are providing support and assistance to each other, and that ability to help others that are dealing with the same problem you are dealing with helps create a positive self-image and self-growth. So a good example of that would be Alcoholics Anonymous. So people that go to Alcoholics Anonymous very often are able to stop drinking, and they haven't had a problem with drinking for many, many, many years, but they realize that they need to go to continue to get the support that they need to keep themselves away from drinking. But they also have a really good gift that they can give members that are just joining the group. They can share what they've learned to help to keep themselves from drinking and support those newer members, and then that positive self-image and self-growth from being elevated to a resource and a person that has that knowledge and ability to help another is healing in and of itself as well, and it continues to keep them motivated to be off their alcoholic tendencies as well. So it serves two purposes. It helps the newer people, and it really is a good way of reinforcing the growth that the person that has been a long-time member has achieved. It can be a corrective recapitulation of the primary family group, whereas there's family conflicts that were never resolved in a person's life, and because they're involved in a group that kind of revisits some of those conflicts, that kind of brings them back up. It allows a person to deal with those conflicts and resolve them because they weren't resolved with the family group, but now they can be resolved in this situation, and it kind of can be a good way to provide that resolution. So I've mentioned this before, the development of socializing techniques. Again, learning new social skills and adapting the social skills and having inappropriate social behaviors be corrected by the group. We talked about that. Imitative behavior. Again, people that have mastered a particular psychosocial skill or developmental task are then the role models for others. So, and you can see that these curative factors are fluid. So imitative behavior, I talked about Alcoholics Anonymous. I mean, a person that has mastered the ability to not be tempted to begin drinking again is sharing that skill that they've mastered with people that are need that role model. So that's an imitative behavior as well. They want to emulate. People that are in the group want to emulate those that have mastered the skill. Interpersonal learning, it just gives opportunities for people to interact with each other, which is just an opportunity to be exposed to that type of practice situation. I mean, if you want to practice how to interact effectively with other people, you can't do that by yourself. So a group gives you the opportunity to practice those skills. Group cohesiveness, it gives members a sense of belonging. It's really empowering for people to feel that they are part of a group, and again, it keeps them from feeling so isolated. Catharsis, it allows people to express positive and negative feelings to release the stress that could be encountered if people were trying to hold those feelings inside, and if they never had an opportunity to express them, then they seem to fester and they can develop into stress-related illnesses. And then existential factors, where the group members assist other people to go into the direction of their own lives and accept the responsibility to have a quality existence of their own. It allows people to not only have a sense of support and cohesiveness from the group, have that sense of belonging, it can take it a step further, where it allows people to have independence and accept responsibility for their own decisions in their life. And this slide just goes over the phases of group development. So it's important, if you're going to be part of a group, or a leader of a group that you understand these phases. So phase 1 is the initial or orientation phase, where the leader and the members work together to establish the ground rules or the goals for the group. The leader's purpose is to promote trust, so that's important for you to understand, and to ensure that the rules don't interfere with being able to fulfill the goals of the group. So if the rules are so strict that the goals can't be achieved, that's something the leader needs to be aware of or has to adjust. Members are superficially and overly polite, and trust has not been established. So this is just, people are getting to know each other, they're feeling out their roles and their boundaries. In the middle or working phase of the group, you're starting to have productive work toward the completion of the task. So in other words, there's real jobs being done, real roles being assigned. The leader starts to step back from being so directive and becomes just more of a facilitator, because they've got the group off the ground now, and they're just trying to allow the group to work together and be cohesive. And the trust has already been established between the members, and there's a cohesiveness among the members. Conflict is managed by the group members themselves. And then in the final phase is the termination phase. People are starting to realize that the group process is coming to an end, and they might be starting to feel a sense of loss, or precipitating the fact that they're going to not be meeting together. They have a grief reaction, and that's normal. A normal part of them understanding that this group is coming to a close. So the leader's job would be to encourage the group members to discuss those feelings and to reminisce about how they've accomplished, focus on the accomplishments of what they've achieved together rather than the fact that they won't be working together any longer. Sometimes members can get a really big sense of abandonment, and then it can move into a grief reaction because they've experienced previous losses that have been triggered by the fact that this group and this support is coming to a close. So this slide talks about the different types of leadership styles. I'll bet all of you can think back to different jobs or groups that you've been involved in and can recall a leader that demonstrated one or both or all three, two or all three of these different styles. An autocratic leader is where the leader's focus is on themselves, and they figure that they're the only ones that can come up with the solution to the problem, and the members look to the leader as well as being the one that calls the shots. And so the leader makes all the decisions, gives people permission to do their tasks. The production is you usually end up with a good amount of achievement of the goals, but the morale is usually low because people don't feel as much that they didn't participate as much. They felt that the leader made all the decisions, identified who did what work, and so the leader gets all the credit for everything. Even though they did achieve goals, the members don't have as much of a morale boosting feeling about their involvement in the group. Whereas a democratic leader will focus on the members and allow them and encourage them to participate as fully as possible. They'll encourage and enlist their problem-solving skills, and what they do is they take action to affect change along with the members in the group. So they're not the only person that determines that the group is either on target or off target. They encourage people to be the ones to decide which direction this group should be going. So production might not be as high as with an autocratic leadership group, but the morale is much higher. And with a laissez-faire leader, they just it's like oh, whatever. That's their kind of approach. Whatever. No focus to have a specific direction is given by the leader. They don't really define the goals. The members just can do whatever they want to try to work toward the goals if they want to work toward the goals. So in this situation, productivity and morale are both low. And then membership roles, the roles of the members. The task roles serve to complete the task of the group. Maintenance roles work to maintain or enhance group processes. So you can have both of those things occurring at the same time. You're working to achieve the task of the group as well as working to enhance the way the group works together. whereas individual or personal roles, people kind of assume those roles to fulfill a personal or individual need. So they are there for the group for a personal reason, and sometimes it follows along with the purpose of the group, and sometimes it doesn't. So this kind of breaks down even in more detail what's going on when people are assuming task roles, maintenance roles, or if they're trying to, if they have an individual thing that they're trying to achieve in the group. If a group member is trying to contribute to the success or effectiveness to the group, trying to achieve the outcome, a successful outcome, they're going to help coordinate, evaluate, they're going to elaborate on what's been discussed, they're going to energize the group, initiate, or orient. So you can look at table 10.2 in your book, and it kind of goes over these subgroups or the roles within a role of the group. The maintenance roles are also going to help move the group along in ensuring that the group is effective. That's how it contributes to the success of the group. It's ensuring that the group is working together well. So compromise, encourager, follower, gatekeeper, harmonizer are all examples of maintenance roles. Those individuals or members that are taking these personal roles on are trying to just satisfy their own needs. And sometimes these sub-roles can interfere with the effectiveness of a group. For example, an aggressor, a blocker, a dominator, a help seeker, monopolizer, the mute or silent member that doesn't seem to participate, the recognition seeker, or the seducer. And again, you can look in the table 2.2 in your book and get a better description of what these kinds of sub-roles, descriptions of these sub-roles. So it's important for you to be familiar with them because you need to be able to recognize when these happening in the group that you're working with and kind of understand how it is or is not contributing to the success or effectiveness of the group that you're participating in, and be able to identify it. So I would suggest that you become familiar with these terms and descriptions and be able to recognize them if you were to see them if you were working in a group, as well as be able to recognize them if you were to see them described in an example scenario in a question, for example, for this course as well as for the NCLEX. Because it's going to be a big part of the nursing role that you'll be involved in your profession, is to be working in groups, whether it's just working with colleagues in an organization or whether it's working with patients in a group situation. You really need to be able to understand when you see these kinds of examples. So psychodrama is a specific type of group therapy. It's a specific type of intervention, a group intervention, and it's employing the ability for the client to have an ability to reenact what's going on in their life to help them practice how to handle it. So a specific client will be called the protagonist, is selected, and they are going to reenact or portray a life situation that they're trying to deal with. Other members of the group play the roles of the people with whom the protagonist has these unresolved issues. So a person might decide that they're having a hard time explaining to their mother that they don't really want to participate in, maybe they don't want to go to a certain cultural event that the mother wants them to attend, and they feel that they have a right to be able to decline to go to this event, but they don't have the ability to stand up and say that to their mother because they're nervous about it, or they just don't feel qualified to do it in a way that they feel wouldn't cause a big family crisis. And so they might volunteer to do this psychodrama to allow that to happen. It could be that somebody in a group wants to figure out a way to approach a family member and tell them that they think that they're drinking too much. Could be a lot of different things, but they're the ones that they've identified themselves as the protagonist, and they want to practice reacting to a life situation that they're already exposed to. So group members that don't participate in the psychodrama are acting as the audience, and then the group leader is the director. And the purpose is, again, as I said, to provide the client a safe place with which to confront how they're feeling these unresolved conflicts in order to help them move toward an ability to resolve it. And nurses who work as psychodramatists require specialized training beyond the master's degree. So this is a very detailed, very specific therapeutic intervention. It's not just something that you decide to do off the cuff with a group of people. It's something that has a therapeutic basis, and it needs to be done by experts. Nurses might be involved in these groups, but they're not the leaders and they're not the directors. They're not the ones that have made the decision to utilize this type of a group approach to helping people deal with their problems. They're not the ones that initiate this. So what a psychiatric mental health nurse's role is in group therapy is to lead the various groups, such as client education groups, assertiveness training, support groups, parent groups, helping groups transition to discharge, things like that. And if you want more details, you should look at the American Nurses Association that specifies exactly what types of groups nurses and what kinds of roles nurses have in groups. If you are going for an advanced practice degree, then you would want to see what the guidelines are for advanced practice roles and make sure that you're always practicing within your scope of practice. So I have a few practice questions that we'll go through next. So during a group meeting, the client raises a question or a concern, that they that there's a lot of noise going on at the nurse's station, keeping him awake at night. The nurse is present in the meeting and interrupts the client and says, "I'll handle this matter. We need to move on." So what type of leadership style is this nurse demonstrating? So you can pause it so you can look over the choices. And the correct response is B. This is an example of an autocratic leadership style. It's restricting the ability of the client to participate in planning their care because the nurse is demonstrating that they are in control and they're limiting client autonomy. After a supportive therapeutic group, a nurse hears one client say to another, "I never thought that other people had the same problems that I have." The nurse ascertains that this statement represents which curative factor described by Yalom. And you can pause it and look at those choices. And the correct answer is C. According to Yalom, the curative factor of universality occurs when group members realize that they are not alone in their feelings and experiences. A client expresses a desire to begin attending the self-help group Alcoholics Anonymous. Which nursing response gives the client pertinent information about this type of group? Go ahead and pause it, and then I will give you the answer. The correct answer is B. AA is a type of self-help group. In this type of group, members share their experiences and strengths and receive comfort and advice from others undergoing similar experiences. The nurse is giving the client pertinent information about AA. So thank you very much for your time and attention listening to this PowerPoint presentation. I hope you found that it was helpful. And thanks again for your attention and watching it.